Yeah, sounds good. What's the is there like a difference, especially like as you have like two experience, you have with two different products with different type of regulation on each, how that the type of regulation of this medical device impacts the feedback from investors and your capacity to raise the fund? What
Yeah.
if that's related? Yeah.
Well, it's huge. It's huge. So you didn't mention my middle company. Actually, I have three. The middle one, which also had a good exit, was a transcatheter valve company. So that's an implantable heart valve through a catheter. That's class 3 device, exclamation point. And so the timeline is important because investors are not investing for a dividend. They're investing to get their money back at a big multiple, hopefully. And the longer you hold their money, the worse it is for them. So it's got to have the bigger the payout has to be at the end, or potential payout. So, most people, there's really three classes of devices in the US and mostly for Europe too. A class 1 device, which my current one is, which is basically called self-certify, where you have to have a quality system in place, all this stuff, but there's not really a regulatory review for it. That's the best because you can go to market as soon as the product is developed and you've done your own internal testing. Class 2 device or 510K device, let's say. 510K device is one that requires review by the FDA, but the average review cycle is about 9 months. They have to respond to you within 6, and typically it's 6 months to a year before you get your final approval from them. And so that's not too bad. A PMA device or pre-market approval device is one that is an implantable device or something totally new, never been done before. And those devices typically have timelines, regulatory timelines of 2, 3, 4, 5 years. That require a large pivotal randomized trial. So the cost. So I always say, if you're doing a class 3 device, you better be a young person, because if you're an older person, you're never going to see, your relatives are going to see that money, but you're never going to see it. So obviously the question that most frequently gets asked in medical devices is this a 510K device? It's a 510K device, good. If it's a PMA device, then it better be a big device, and there better be a good chance that your company is going to be taken out or sold somewhere in that development process, because it's so good. A major strategic wants it, like a Medtronic or a Boston or somebody else, and that is usually what happens to class 3 devices when they're big. But everybody knows they're in for the ride if it's a class 3, whereas if it's a class 2, and particularly class 1, it could be a relatively short-term investment with a good yield.
So